Good afternoon, everyone. Welcome to our TCM and Acupuncture Basic by LUM. Let's start the ball rolling with the first topic. Let's welcome Ma'am Neets Yu of Silang, Cavite. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector. Good afternoon, everyone. So, topic for today is about blood in our 14th day, Shwe. Okay. So, let's go to the tongue description. Red tongue with kidney deficiency. It is a common result of kidney deficiency, which is developed from the heat, from deficiency. So, matagal na siya. So, nada-dry up yung fluid and injures the blood. When this occurs, tongue appears red and dry with little coating. Okay. The stronger the heat, the greater the injury to blood and fluids, which in turn leads to redder and drier tongue body. Symptoms associated with kidney deficiency with heat is tinnitus, night sweats, hot palms and soles, dry mouth, flushed face. Okay. If in constrained heat, smoldering fire or fire toxin can develop. Yun yung extremely red tongue covered with a yellow coating. Makikita niyo po yun. So, symptoms associated nito, yung fever, irritability, dry mouth and throat, thirst, mouth ulcers. Remember po yung symptoms. Heat and fire are capable of injuring blood and blood vessels, so there is spontaneous bleeding. Heat in the blood, there is excessive menstrual bleeding, red, itchy skin lesions, general feeling of heat in the body. Okay? In this case, yung tongue body is completely red. Parang deeper red or scarlet red yung color. To evaluate origin, the degree, intensity of heat or fire, and resulting injury to yin and fluids, practitioners should observe not only intensity of red discoloration on tongue body, but also its shape and coating. Okay. Heat generated by deficient yin that smolders for a long time in the body and then becomes uncontrollable. It will affect the essence. Okay. This energetic deficiency, yun yung nade-develop after over a course of years or be accelerated by serious illnesses, nagkakaroon ng sudden collapse of yin, which thereby allows siyang to rise uncontrollably. Hindi makontrol yung pag-rise ng yang. So, mildest expression of this energetic imbalance is sudden loss of hearing, while its most severe form is cerebral stroke. Okay? In some cases, burning out syndrome, often followed by nervous breakdown, is subject to same pathology. A good visual image for what happens energetically is a candle burning at both ends. Yung kandila po. Okay? Ayan po yung picture. Pati yung observe po yung tongue. Okay? Candle wax is the substance. Yun yung essence yin and yin. While the flame corresponds to yang. At the end, when the wax finally burns away, there is a short, intense flickering of the flame, which is excessive yang. Okay? Upward blazing fire in the body vents itself in myocardial infarction, stroke, hypertensive crisis, or uncontrollable bleeding. Tongue body is red, dry, contracted, or stiff. Yung mga na-stroke, tingnan nyo po dila. The heat has injured fluids and yin so severely that the muscles, the sinews, tendons, including those of the tongue, become malnourished. So this condition can cause internal movement of wind. Deep red discoloration of tongue also arises when heat enters the nutritive and blood levels. Okay? This pathology can produce a soft red tongue, indicating malnourishment of the sinews and tendons due to extreme heat. Sobrang init. Patients with this tongue type often suffer from hemiplegia following the stroke or from atrophy disorders. The soft red tongue is unfavorable prognostic sign. Okay? Thank you very much for your attention.
Thank you
po.
very much, Ma'am Neets. Up next is climatic pathogenic factors, and let's welcome straight from Legazpi, Sir Dino Pinheiro. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we go to the climatic pathogenic factor, part 5. Now we come to the wind. Climatic wind could cause a local block, or it can affect organs of the wood element, liver, and gallbladder. So sa first tower diagram, which is acute, sa treatment, we need to sedate the young, which is the wind elimination points. And next, we have the acute tower diagram. We need to sedate the young, wind elimination points. And next, we have the subacute, decrease naman siya, yung yin. We need to sedate the yang and tonify the yin, which is the wind elimination points. And last, the tower diagram, we have the chronic. Mababa na po yung yin, so we tonify the yin, wind elimination points. Wind symptoms can manifest in any organ system. Wind symptoms are irritating, wandering, paroxysmal, and blocking. Moxa to be used only in damp situation without heat. Sa irritating, symptoms of irritating are sneezing, itching, photophobia, phonophobia, aversion to wind on skin, also with emotional irritability. All allergic reactions are wind symptoms. Next, wandering. These are symptoms that move through the body. Typical examples are wandering pains in rheumatoid arthritis, fibromyalgia, or dermatitis that wanders around without a fixed loci. Paroxysmal, as wind comes in gusts, wind symptoms also appear and disappear suddenly. So any suddenly appearing headache, epileptic fits, sudden allergic reactions, and paroxysmal pains as in trigeminal neuralgia, colic, bronchospasms are good example of this. Next, we have blocking. Wind can either sensory organs such as ears or nose and get blocked there, not being able to get out. These can also block nose or ears. It can also get in through the skin pores and get blocked in the muscles, causing muscular pain due to drought. At worst, wind can block the exterior acupuncture meridians, creating a situation of unequal energies between the two sides of the body, causing hemiplegia or facial paralysis. Sa treatment, restrict sour food and alcohol. They increase liver yang, thus causing endogenous wind. Wind eliminating points. Wind symptoms can be treated locally, especially if they are caused by exogenous wind or when they are localized. The following points can be used for this purpose. GB20 do 16 para sa head and neck. Small intestine 12 for shoulders and arm. UB12 for back, lung, and skin. GB31 for hip and leg. Buffing, 8 wind points for the feet. These are the 4 points on each foot. One of these point, liver 2, is the wind elimination point for the entire body. Point stomach 44 is used against belching. And point GB44 is used in wandering or paroxysmal pains along its meridian. Yung back C naman is 8 wind points for the hands. Wind example, wind cold in the lungs, acute hay fever with sneezing, itching of nose and eyes, urticaria, neurodermatitis, rapid and wiry pulse on lungs. Sa treatment, we use liver 5, which is the leukonectin point, GB40, the U1 for sedation, lung 5 removing heat technique, and wind elimination sedation on appropriate region. Next, our diagram, wind heat in kidney. Acute wandering pains of many joints, stiffness of joints, feeling cold and numb. Better with warmth and movement. Loose pimples on skin with a person to wind, slow wiry pulse in kidney. Sa treatment, we use kidney 5 sedation on acute point. Wind elimination, tonification of appropriate region. Since wind is always combined with either heat or cold, when using wind elimination points, one has to be clear with combination it could be. Depending on whether it is wind heat or wind cold, the wind elimination technique is combined with tonification or sedation technique. Okay, another table, we have the comparison between wind cold symptoms and wind heat. So wind cold, we have wandering symptoms or worsening with cold. Example niya is rheumatism. There is a feeling of cold in affected area. It is not important whether the patient has fever or not. There is more black feeling locally, black nose or ear, etc. Watery or white mucus. There is less urine and stool lighter than usual. There is slow and wiry pulse. There is thin white tongue coating, and use wind elimination tonification technique. While sa wind heat symptoms, there is wandering symptoms worsening with allergy like eczema and urticaria. There is feeling hot in the affected area. It is not important if other areas are cold. Also, more irritation locally like itching, sneezing, often thick or colored mucus. There is increased thirst, urine, stool darker than usual. There's rapid and wiry pulse. There's thin yellow tongue coating, and use wind elimination sedation technique. Thank you po for your attention.
Thank you very much, Sir Dino. Up next is yin-yang relationships. We are still on interconsumption. Now part 3. We now go to examples that in which the yang consumes yin. So we have here exposure to heat or yang over a period of time. So as a reaction, the yin will increase initially. After a short period, the yin will be consumed, and this will cause dryness, loss of weight. This is deficiency of yin caused by exposure to yang factors over a period of time. These yang factors could be stress, exposure to climatic heat or fever, excessive alcohol consumption. The body has to supply the yin from the interior in order to control the excess yang. After a point, it is only natural that the yin will be exhausted. So there will be symptoms like loss of fluid, loss of weight, malnutrition, or reduction of substance or structure. Clinically, this shows symptoms of dryness, weakness, exhaustion, burnout, loss of weight, and poor endurance. Treatment: tonify yin, sedate the yang. This is a subacute state where the yang pathogenic factor has made a lasting damage to the yin of the body. So this is caused by a substantially strong yang or a longer period of disease. For example, high fever, prolonged and regular consumption of alcohol. Yin deficiency means that much fluids, nutrition and sleep are needed to improve this lack. And unfortunately, this cannot be substituted by anything else. Tonification with needles, however, will help the body with absorption and distribution of needles and of nutrients and fluids. We can also improve appetite, digestion, thirst, and the quality of sleep with acupuncture. Let's go to example 2, still on yang consuming the yin. So we have bacillary dysentery following food poisoning. When yang increases because of infection, the yin increases to contradict it. So we will have watery stools. The infection is similar to a blazing fire where you need a lot of water to extinguish it, and the body releases its fluid to control the heat. As the diarrhea continues, patient becomes dehydrated and stools become smaller and are accompanied by mucus. Sometimes patients will pass only blood as the body tries to eliminate heat by bleeding, as it is unable to balance the heat by increasing the yin. Blood not only circulates the nutrients throughout the body, it also circulates heat. If blood does not reach our fingertips, they would remain cold. But when there is too much heat in any part of the body and there is insufficient fluid to cool this heat, the simplest way to reduce the heat is by dispersing it to the outside. This is done very quickly and effectively by the body by bleeding. Examples to illustrate this are nosebleeds, coughing blood in tuberculosis, vomiting blood in stomach ulcer, excessive bleeding, not clotty in menstruation, and hemorrhoidal bleeding. Treatment: sedate the yang and tonify the yin in the large intestine, balance the fluids and salts with infusions if necessary. Excessive spontaneous bleeding shows 2 problems. There is too much heat, there is insufficient fluid. As long as the body has enough fluid, it will react with fluid, not blood. Thank you very much for your attention. We now go to the 5 elements. Let's call on Sardino once again. He will continue discussing the fire element. Good afternoon ulit, Sardino.
Good afternoon, Doc. Good afternoon sa lahat. Now we go to fire element part 5. The coupled organ is small intestine. The small intestine couples with the heart and has an internal link with it. Each time the heart is imbalanced, the small intestine will become imbalanced in a similar way. This may cause immediately such as acute abdominal symptoms during a heart infarction, or later as an malabsorption diarrhea in heart chi deficiency. Small intestine is an organ that absorbs nutrients and fluids for the body. Yang dominant state: severe colicky pain radiates to groin or to the back with urgent stools or diarrhea. Distension with much of activity, perhaps also vomiting, fever, pain on pressure. Symptoms worsen with activity, coffee, alcohol, spicy or sour foods, and improve with bland, light, and overcooked food. So, yang dominant states, ang first diagram, we have the acute. Mataas po yung yang. Sa chronic, bumaba po yung yin. And sa subacute and recurrent, mas tumaas po yung yang. Yin dominant state, we have the dull, constant pain, heavy, weighing down, distension without much wind, malabsorption diarrhea without much pain. Symptoms improve with activity, black coffee, dry foods such as toast. Worsen with fatty foods, milk foods, salads, and raw cold foods. Sa yin dominant states, we have the acute, yung yin mas tumaas, And sa chronic, nasa normal ang yin, bumaba yung yang. And sa subacute recurrent, tumaas po yung yin, mababa po yung yang. Paroxysmal tachycardia. At the time of tachycardia, heart yang is in excess. This would be treated with points PC6, heart 6 sedation, DO20, and SI8 sedation. It is more important to prevent further episodes from recurring. There are 3 imbalanced states of the heart that can cause paroxysmal tachycardia. Heart yin deficiency is most common. These states that and their balancing treatments are given below. Sa treatment, local points, we use REN 14, distant points, PC6, and symptomatic points, we use DO20. Okay, sa first tower diagram, we have the blood and chi deficiency. Parehas po mababa. Tachycardia and irregular arrhythmia on exertion with breathlessness. Merong weak voice, depressive, low blood pressure, cold, good in moderate weather. Sa treatment, we use REN 14, UB 15, REN 17, UB 14. Next tower diagram is the heart yin deficiency. Paroxysmal tachycardia on excitement or anxiety can occur anytime. Normal heart rate is around 80 to 90 beats per minute, not necessarily rapid. Anxious, excitable person. Sa treatment, we use REN 14, heart 5, spleen 6, kidney 7, and liver 3. Next tower diagram is the chi deficiency and blood stagnation. There is normally a bradycardia, has missed beats on and off, regular arrhythmia. Better in warm and dry weather, often worse in wet, cold weather and nights. Dull, sleepy person, there is edema and cyanosis. Sa treatment, we use UB15, SI7, which is the loop point. Also, we have stomach 40, UB20, and UB23. So initial treatment, 2 times weekly, about 4 sessions. And then maintenance once weekly for 4 sessions. And sa treatment, 1 per month in 4 sessions. Thank you po for listening.
Thank you very much, Sir Dino. Let's now proceed to Jing. Okay, we will continue where we left off. We are now on day 5 for Jing, or essence. Essence is organic substance that forms the basis for growth, reproduction, and development and aging. In children, essence controls the growth of bones, teeth, hair, normal brain development, and sexual maturation. After puberty, essence controls reproductive function and fertility. It forms the basis for successful conception and pregnancy. Natural decline of essence during our lifetime leads to natural decline of sexual energy and fertility. So as much as possible, we should preserve our essence. Aging itself is a process of decline of the essence. Men's essence flows in 8-year cycles, women's essence in 7-year cycles. Tiangui refers to sperm in men and ova in women. The kidney energy of a girl becomes abundant at age 7. Her baby teeth are replaced by permanent ones, and the hair grows. At age 14, the Tiangui arrives, so she will now ovulate and menstruate. Directing vessel begins to flow. Penetrating vessel is flourishing. Periods come regularly, and she can conceive. At age 21, kidney essence peaks, wisdom teeth come out, growth is at its utmost. At age 28, tendons and bones become strong, hair grows longest, body strong and flourishing. At age 35, bright young channels begin to weaken. This is the stomach and the large intestine. Complexion starts to wither, hair begins to fall. At age 42, 3 young channels are weak, the face darkens, hair begins to turn gray. At age 49, the directing vessel or conception vessel is empty. So, hindi na pwede. Okay, penetrating vessel is depleted, the chong. Tiangui dries up, earth passage or the uterus is not open, so weakness and infertility set in. In a man at age 8, boy's kidney energy is abundant, hair and teeth grow. At age 16, kidney energy is even more abundant. Tiangui arrives, essence luxuriant and flowing, yin and yang harmonized. At this age, the man can father a child. Okay. At age 24, kidney energy peaks, tendons and bones strong, wisdom teeth appear, and growth is at its peak. So after age 24, hindi na po tatangkad. Ito na po yung last day, the deadline. Okay. At age 32, tendons and bones are at their strongest. Muscles are full and strong. At age 40, kidney weakened, hair begins to fall out, teeth becomes loose. At age 48, young chi exhausted, face becomes darker, hair turns gray. At age 56, liver energy weakened, tendons cannot move, tiangui dried up, kidney becomes weak, body begins to grow old. At age 64, hair and teeth are gone. Ouch. Okay. Thank you very much for listening. We now proceed to Zangfu organs. Let's call once again Ma'am Needs You from Silang, Cavite, certified acupuncturist. Good afternoon, Ma'am Needs. Ulit.
Good afternoon, Doc Heck. Good afternoon, everyone. So, topic for today is about the stomach naman, stomach functions. Okay. So, ang stomach is responsible for reception and ripening of food. Stomach begins transformation of food by separating the food into pure and impure aspects. So, yan pinag-drag. The pure parts, tinatawag nating essence or the nutrients, are sent to spleen. The impure parts are passed on to the small intestine. Okay? Since food after decomposing in stomach passes on to the intestines, stomach governs down-bearing of turbid. This downward action stands in complementary opposition to spleen's function of extracting the essence. Okay? Spleen governs upbearing of the clear. Spleen governs upbearing of the clear. Stomach and spleen stand in exterior-interior relationship and are basis for postnatal chi. Okay. Stomach is referred to as the source of fluids or sea of grain and water. It requires fluids to prepare food for spleen. Okay. Let's go to stomach relationships. Spleen and stomach. Spleen and stomach stand in interior-exterior relationship. Physiologically, spleen governs transportation and transformation, TNT, and stomach governs intake. So, exterior-interior. Stomach and spleen complement and counterbalance each other. Although stomach disorders have to be differentiated from spleen disorders diagnostically, it is often seen in daily practice that the disorder of either spleen or stomach affect the partner organ as well. Parati magkasama. Okay? Stomach and liver. Liver governs harmonious flow of qi. If energy and emotions flow freely, harmonious digestion can happen. Okay? If liver's free coursing action is impaired, there is depression of the liver. Qi affects digestive function. The liver attacks the stomach. Okay? Let's go to stomach pathology. Deficiency patterns, stomach G deficiency, stomach yin deficiency. Excess patterns, rebellious stomach G, stomach cold, stomach fire, retention of food in stomach, phlegm heat in the stomach. Okay? Let's go to stomach G deficiency. Stomach G is weakened, so there is stomach's function of food intake and decomposition is impaired. Ayan po yung tsura sa dila. Okay? Okay, ayan po yung dila. Stomach G deficiency and spleen G deficiency are connected closely. Stomach G deficiency can be considered an initial stage of stomach cold. Okay. Cardinal symptoms: fatigue, lack of appetite, decreased tears, loss of taste, soft stool, uncomfortable feeling in epigastrium, better with touch. Okay. Empty pulse in stomach position. Okay. Stomach deficiency, initial stage of stomach fire. Tingnan niyo po yung dila. Filled yun sa gitna. Okay. Cardinal symptoms: hunger without appetite, thirst without desire to drink, dry mouth, constipation, pain in epigastrium, vertical tongue cracks, no tongue coating. Tingnan niyo po rin yung dila. Okay. Rebellious stomach G pa rin. Impaired harmonious downbearing of stomach. Stomach G is ascending and counter flows up opposite on its normal direction. Okay. Cardinal symptoms: nausea, vomiting, belching, hiccup, and heartburn. Stomach cold naman, result and further complication of stomach G deficiency. Okay. Cardinal symptoms: stomach pain relieved by warmth, preference for warm drinks and food, absence of thirst, vomiting of clear liquids. Okay? Stomach fire, yun yung result and further complication of stomach yin deficiency. Notice po yung tongue ulit. Okay, mapula sa gitna. Walang peel. Peel siya, walang coating. Walang. Cardinal symptoms ng stomach fire is tears, desire for cold drinks, bad breath, burning pain in epigastrium, excessive appetite, and bleeding gums. Okay? Retention of food in the stomach naman. It arises when food is not decomposed in stomach and is attributed to dietary irregularities. Yung voracious eating and drinking. Katakawan ba nga? Okay. Cardinal symptoms: vomiting after eating, pain in epigastrium that worsens with eating, loss of appetite, sensation of oppression, and fullness. Okay? Phlegm heat in the stomach, it can develop from stomach fire or from damp heat in the spleen. The heat condenses and then dampness into phlegm. It condenses, dampness into phlegm, okay? Cardinal symptoms: burning pain in epigastrium, feeling of oppression in epigastrium, yellow tongue coating, mouth ulcers. Okay. Thank you for your attention, everyone.
Thank you very much, Ma'am Needs. Next, we have meridian theory. And let's listen once again to Sir Dino Pinheiro.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the spleen channel of foot thigh yin. Spleen meridian of foot great yin. The spleen meridian is a great yin meridian And like lung, it belongs to a very important nourishing organ of the body. The spleen meridian starts on the medial side of the big toe and flows upward along the medial side of the foot. The yang of the meridian gives the tension to the tendon and muscles in the area where it flows. In the case of weakness of spleen yang, one may see a hallux valgus of the big toe. This can be corrected by applying hot needles in the tender points on the distal part of the spleen meridian. The meridian flows on the medial side of the leg to the abdomen, and there it flows lateral to the stomach meridian and at the thorax. It turns to the side and ends at the mid-axillary line. The inner branch connects with the stomach and the spleen, passes through the diaphragm, runs along the esophagus, and ends at the base of the tongue. First, we have the spleen 1. Location on the big toe, 0.1 tune from the medial corner of the nail. Point explanation, the first and the wood point of the meridian. It receives the energy from the exit point of the stomach. Point 42, stomach 42. It is a point that naturally improves the yang of the spleen as it is the grandmother point. Giving moxa on this point would enhance this use. Spleen 1 needle or moxa is used to treat the craving for sweets or in overweight patients or those with diabetes mellitus. Also, it is an excellent point to stop bruising or slow bleeding symptoms. Next, we have the spleen 2, sa location on the medial aspect of big toe. At the junction on the red and white skin, distal to the first metatarsa phalangeal joint. Point explanation, the tonification point of the spleen, both yin and yang, through more yin than yang. Next point, we have the spleen 3, which is located on the medial aspect of the foot in the depression proximal to the head of the first metatarsal bone at the border of the red and white skin. Spleen 3 is the earth point and the house element point of the spleen. This is a very effective point in tonification of spleen yin. It can be used to improve storage of nutrients and to slow down the emptying time of the stomach. It is therefore beneficial in the treatment of hypoglycemia and preventing loss of weight. Next, we have the spleen 4, which is located in the depression distal to the base of the first metatarsal bone on the border of the red and white skin. Spleen 4 of the 14 meridians that include the Ren and Du extra meridian, the spleen is the only meridian which has 2 Lu collaterals that connect it to the coupled meridian stomach and 2 Lu connecting points. So we have spleen 4 is the minor Lu point. It is used to tonify spleen yin and to reduce spleen and stomach yang. An example would be dry, cracked lips with inflammation and pain. Next, we have the spleen 5, which is located in the depression at the junction of a vertical line drawn along the anterior border and a horizontal line drawn along the lower border of the medial malleolus, or in the depression halfway between the highest prominence of the medial malleolus and the tubercle of the navicular bone. Sa point explanation, this is used for the sedation point and metal point of the spleen. Sedates more yin and less yang. Thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last topic, breathlessness. We will continue discussing the patterns. Lung qi deficiency. Clinical manifestations: shortness of breath, weak lung sounds, slight rattling sound in the throat, sweating, chilliness, pale face, weak voice, expectoration of scanty phlegm. The tongue is pale, the pulse is weak, especially on the right front position. Treatment principle: tonify the lungs, strengthen the qi, restore descending of lung qi. Points: lung 7, lung 9, bladder 13, do 12, ren 12, ren 6, stomach 36, using reinforcing method. Lung 7 and lung 9 tonify the lungs and restore the descending of lung qi. Bladder 13 and do 12 tonify lung qi. Direct moxa can be used. Ren 12 and ren 6 tonify qi in general. They are also concentration points along the lung channel, which starts over ren 12 and flows down to ren 6 before coursing back upward. Stomach 36 tonifies stomach and spleen, and this helps the lungs according to the principle of strengthening earth to tonify metal. Lung yin deficiency. Clinical manifestations: shortness of breath, chronic breathlessness, sweating at night, dry throat, dry cough with scanty sputum, malar flush. Tongue dry and without coating, red body if there is empty heat. Pulse is floating empty or fine, rapid, and weak in the right front position. Lung yin deficiency can occur in combination with lung qi deficiency. Yin deficiency is more common in old people. So if you see an elderly person, then this is the more likely diagnosis. Only in very advanced cases would the tongue be completely without coating. In other cases, it could have a rootless coating or a lack of coating only in the front part. Treatment principle: nourish lung yin and restore the descending of lung qi. Points: lung 9, lung 7, kidney 6, lung 7 and kidney 6 in combination. Bladder 43, ren 4, bladder 13, do 12. Reinforcing method: lung 9 tonifies lung yin. Lung 7 and kidney 6, you have to use this in combination. We'll open the directing vessel or the ren, nourish the yin, restore the descending of lung qi, and benefit the throat. The combination of these 2 points is excellent in cases of chronic breathlessness from lung yin deficiency or both lung and kidney yin deficiency. Bladder 43 nourishes lung yin and is particularly effective in very chronic diseases. Ren 4 nourishes yin in general and strengthens the kidneys' grasping of the qi. Bladder 13 and do 12 will tonify lung qi. Thank you very much, everyone, for joining, and hope to see you again in our next presentation. Thank you, everyone, and good afternoon.